we know that there are breakthrough cases, but does this surprise you that there were 44 cases within one football team?
So it doesn't at all surprise me, because essentially what's going on here is Delta is a very transmissible variant. It can be in lots of people's noses, and they are not testing regularly once they're vaccinated. Really, the CDC has been clear that if you feel well and you're vaccinated, then there's no reason to test regularly. That recommendation was made prior to the vaccines, when you could feel well, have it in your nose, and spread to others. So this is not a CDC recommendation to do mass asymptomatic testing of vaccinated people.
So what does this outbreak or this cluster of cases in Berkeley tell you? What does this say?
You know what this says to me is that with a highly transmissible variant, if we ended up going around and doing asymptomatic testing of groups of individuals who are together a lot, we are possibly going to see Delta in their nose. And there could be 44 out of 100 people right now. Again, what's clinically meaningful about a test? Two things. One is if that person is unwell, then that's clinically meaningful to them. And also symptomatic breakthroughs are more likely to transmit than having an asymptomatic being fully vaccinated and having it in your nose. There's been contact tracing studies that have shown that if you feel well and have some Delta in your nose, you're not spreading it. And in fact, there was an Annals of Internal Medicine study that they took all these healthcare workers, they tested all of them. 33 people had Delta in their nose one day. They tested them 2 days later, and all 33 didn't have it there the next 2 days later, because we are transiently all getting this virus in our noses. So at this point, in highly vaccinated places, we need to start testing only if people are sick.
Interesting. So this didn't need to get to this point.
This did not need to get to this point. Now, when you have 44 people who have Delta in their nose and they're immunocompromised people, or they're going to be inside, now it's too late. And we have this situation that they've decided to postpone the game, but it did not need to get to this point. Asymptomatic testing of groups of vaccinated people regularly is not recommended. And in fact, it will create the situation that we just saw today.
So let's take this away from the football team and just general public who are planning on meeting with, family members. If we, travel and meet with family, whatever, if we're not having symptoms and we're vaccinated, we really shouldn't test.
Not only should we not test if we're asymptomatic and vaccinated, so again, that's not even a recommendation to test, but your likelihood of spreading it to anyone is very low. There were essentially at least 5 contact tracing studies, one in Singapore, one in Pell Canada, one in Harvard, one at Oxford, and one in the summer camps from the CDC this summer, that if you are fully vaccinated and you feel well, you are not spreading it to other people. That was a category prior to vaccinations. And so a group of people, for example, in San Francisco, 100 people can be in a room unmasked, asymptomatic, and vaccinated without masks, because that is a very low risk environment. So, but if we test people, they could have a little bit of that virus in their nose. And so again, it is not a recommendation unless you're ill.
And so this is a case where we should have more confidence in the vaccine and how well it works.
In fact, if we don't have more confidence in the vaccines, we are going to be in a quote never-ending pandemic, because we tested prior to the vaccines to try to prevent chains of transmission, because we didn't have vaccines and we couldn't know who we were protecting. We couldn't protect our vulnerable people who could get sick. After the vaccines, not only are you very unlikely to pass it if you feel well, but there are also people who have gotten the vaccine around you who are protected. And if we continue to mask and do massive asymptomatic testing among fully vaccinated people, we will have a never-ending pandemic. It is not confidence in the vaccines to keep on testing.
So for people who might have just kind of read the headline and saw, oh, there's this many cases, they all were vaccinated and it still happened, what would you tell them?
I would tell them that I have zero panic whatsoever as a public health person, as an infectious disease doctor, of 44 healthy people who are fully vaccinated, who may have a little virus in their nose on a highly sensitive test. It is not an outbreak. It does not mean that they got sick, and it does not mean that the vaccines don't work. It means that our public health strategy in this case was off, and they were doing mass testing of people who didn't need it.